Good afternoon, everybody. My name is Allison Green. I'm the president of the National Black Prosecutors Association, and I'm so glad to have you join us here today for our presentation in collaboration with ShotSpotter. For those of you that everybody knows what ShotSpotter is, and so it's a technology that we use across the country, basically, to help us detect and deter gunshots, excuse my brain. Today we have here a panel of distinguished gentlemen from across the country that are going to discuss ShotSpotter and the potential community impact that it has as it relates to technology and community partnerships. I'm going to introduce Ron Teachman. He is going to be the host and moderator for this afternoon. And at the end of the session, you're going to have an opportunity for a question and answer sessions for the panelists. And Ron, take it away.
Thank you. And welcome everyone, whatever time zone you're in. It might be afternoon for those of you in East and Midwest, and for anyone else, good morning. And welcome to the webinar, Technology, Data, and Community Trust, Innovation in Supporting Safer Communities. We're going to spend the next several minutes highlighting how technology can help prosecutors and other public safety leaders prevent violence and build trust within their communities. Special attention will be paid to data sharing, violence interruption, trauma-informed care, and supporting successful prosecutions. Allow me to introduce the panelists, and we'll do this in the order that I'll be calling on them. First, Ernest Cato III has been employed by the Chicago Police Department for 31 years. He's actually going to be joining us from a patrol car, maybe responding in the middle of this webinar, I don't know. He's currently serving as the Chief of Bureau of Counterterrorism, where he oversees 24 units. In this current capacity, he focuses on long-term gang and narcotics investigations, provide resources and organization for large-scale city events, and continues to create citywide missions and deployment plans to curb violence with intelligence-led, proactive approaches. Previously, he served as Deputy Chief of Area 4, Bureau of Patrol, where he oversaw 3 Tier 1 police districts, the Area Community Engagement and Support Team, or ACES, and the citywide custom notifications. I'll ask him to explain what that term is, custom notifications, later. In addition, he served as a moderator on the Use of Force Working Group to assist in reform measures within the Chicago Police Department. He's also served, and when I first got to know him, Deputy Chief of Area North Bureau Patrol. We oversaw 9 districts and 2 units, and District Commander of the 15th District, which covers the Austin community. And there he created the Austin Response Team, and I'll ask him to explain that a little bit later, and also collaborative efforts with numerous community organizations. We welcome him today, and there's a host of things I could say about him, but that would consume the hour. He's got a very prolific work experience. But I do want to note that he also served with the United States Department of State in South Africa, which is also a ShotSpotter customer, where he consulted with the local government and police in building community policing programs. Next is Leonard Thompson, Esquire, an assistant state attorney at the Miami-Dade State Attorney's Office. He has served as an assistant state attorney for 5 years and currently handles serious violent felony cases. He's a Miami native and dedicated to serving his hometown community. ASA Thompson received his Juris Doctorate from the University of Florida, Frederick G. Levin College of Law, and his bachelor's degree in political science from the University of Florida as well. Wayne E. Rollins, president of UMA Futures International, is a strategic planning consultant who has assisted rural and urban communities nationwide in developing, implementing, and evaluating successful violence reduction strategies. Mr. Rollins is currently the project manager for Miami-Dade County's Anti-Violence Initiative, a 4-year, $7 million strategy that includes group violence intervention and the nationally acclaimed Walking One Stop. And I'll ask him to explain both GVI and Walking One Stop a bit later. This has shifted the paradigm on how services are delivered to Miami-Dade's most challenged neighborhoods by bringing a one-stop victim service center to the doorstep of residents traumatized by gang and gun violence. And again, he'll elaborate on what those services are and how he uses data to drive or direct those services. Mr. Rollins is also the director of the South Florida Reentry Task Force. His works have been highlighted in national and international conferences and publications. And last but not least, Dr. Gerard V. Tate is a native of the south side of Chicago's Englewood neighborhood. He has nearly 2 decades of law enforcement and violence prevention experience in both military and civilian law enforcement agencies. Dr. Tate has worked directly with international law enforcement organizations in Italy, Japan, South Korea, Germany, and Iraq. As a doctor of social work, he uses his knowledge of the root causes of crime, human behavior, and social policy to advise organizations in the creation, implementation, and evaluation of violence prevention and intervention programs that are both evidence-based and culturally competent. And his Doctor of Social Work degree is from the University of Southern California and a master's degree in socioeconomic development from Washington University in St. Louis. Welcome to all our panelists. And lastly, my name is Ron Teachman. I'm a retired police chief, 38 years in law enforcement, twice a chief covering 8 years in my hometown of New Bedford, Massachusetts, and more recently in South Bend, Indiana. And before I became a representative of ShotSpotter 7 years ago, I was twice a customer, having him deployed the ShotSpotter gunshot detection service, called Respond, in both of those cities. So let me begin by calling on Chief Cato, if you're still available and haven't been called for service, because I know you're on patrol right now. Chief Cato, can you join us now and explain the data and the technologies that you're using in your current role, what you've used in your previous capacities in Chicago, and how that's directed your services? Obviously, you've had great responsibilities in the Chicago Police Department. So let's talk about, particularly as to gun violence reduction, how have you used technology and how effective has it been? And what are the strategies you've incorporated in your work as well?
Well, let's just start with what happened prior to ShotSpotter. Prior to ShotSpotter, the data wasn't there as efficiently, as effectively as it is now. So a commander in a district would have to come in probably about 5 o'clock in the morning to analyze multiple reports and spend the majority of his day looking at the reports and trying to create data, him or herself, the majority of that time. Now with ShotSpotter, we're able to take that data, and it's more effectively because now we're able to get ahead of the retaliatory shootings. So when we see multiple shootings based upon the ShotSpotter data in a certain area that's within certain gangs boundaries, we can predict where the retaliation will go. Now, utilizing ShotSpotter at the community level is very effective because now the community has now gained accustomed to ShotSpotter. I've been in groups where the community will ask, what is ShotSpotter saying? Or they would ask the question simple as, what are those little discs up in the sky? And how do those discs help the community? Well, then we explain how it triangulates the sound and how we are able to respond effectively. Prior to ShotSpotter, what would happen is that shots fired would be in an area. Now, what would happen is that Miss Jackson will be sitting in her living room. She'll hear gunshots. The first thing she'll do is retreat from that room. Then after she retreats to that room, she then will get on the telephone. Now, 3 minutes later, she's on the telephone calling, I hear shots fired. So that's 3 to 4 minutes have just passed. That call has now went to the dispatcher. The dispatcher, the call taker, I'm sorry, it goes to the call taker. Now the call taker has to dispatch. So we're talking what, 10 minutes has passed at this point? Now with ShotSpotter, we're effectively able to respond immediately, even to the point where police officers have gotten into shootings. With that data, we take that data and we look at that data and we determine the gang boundaries of that data. We identify the gangs in those particular areas. Then we look at whether retaliation shootings may occur. We put resources in the area where retaliation shootings may occur, and we prevent the next shooting. We're now seeing reductions in the city of Chicago in shooting and homicides, but by being able to not only use that data to where to place our resources, but also to effectively inform the community of what's going on within those community boundaries. You're on mute, Ron.
I'm sorry. I had some background noise here. So to underscore your comments, Chief, our data on our end from 135 customers shows that 911 only notifies the police maybe 20% of the time. And to your point, when the caller calls, they're usually some distance away. We've measured that out with our customers to be 780 feet or 2.5 football fields. And there's a delay of contemplation. Should I call? What number should I call? Should I call 911? And then, of course, you've got the call taker to dispatcher, and then finally dispatching out, where ShotSpotter can notify you in under 60 seconds. In fact, we contractually guarantee notification under 60 seconds from trigger pull to identifying the location within a very precise point so that you can get there and save a life. Now, you talked about retaliatory violence. You've also worked, and I know when you were in 15, with the Nonviolence Institute in a street outreach program. How do you take your data and help them deploy more effectively? Because obviously, without ShotSpotter, they're working anecdotally to determine where retaliatory violence is and where the data should go. How have you incorporated your data in Chicago? And then we'll ask Wayne Rollins to talk about his experience with walking one step in Miami-Dade. So how have you worked with street outreach in Chicago effectively?
We'll see, and we're going to digress a little bit more, Ron, just a second. Because of ShotSpotter and our using the technology that we presently have, officers are able to see the particular area where the shooting is coming from. So the officer at ground level and within our rooms, our strategic deployment centers, can clearly place those officers where the shootings are coming from. Now, we take that same information and we have conversation with street outreach. We will provide street outreach with the information they need to be effective. We're going to tell street outreach where our shootings are occurring and the gangs that are involved so they can go out there and get in the middle of it all. I find the collaboration very successful. I think the ability to have someone outside the police department to get involved in this fight that we all belong to is the way that it should be. Street outreach, providing street outreach with this data and allowing them to understand this technology puts them in a safer position to actually do their jobs, but at the same time, it's building a partnership that only can get stronger.
Excellent. And you also use the data in shooting reviews, working in group violence intervention, another strategy that I know Wayne's going to elaborate on. What's been your experience with GVI and the shooting review methodology?
You know, early on when you read through my bio, you brought up the term, the Austin Response Team, ART. It's definitely an art. So the Austin Response Team that we created, it was a combination of those who have brick and mortars within the community, community organizations. We looked at churches, we involved schools, and we would bring those at the head of those organizations at the table. We provide them with that data, that same information that ShotSpotter was able to give us. We give them that information. Not only do we give them that information, we also partnership with them to assist us going within these areas to help reduce violence. That partnership is a very important partnership. Now, we get that same information from ShotSpotter that we receive from the Austin Response Team, and we take that to the shooting review. Within the shooting review, we have multiple groups there. We have from our prosecutors, gang teams, FBI, our gang investigation teams, and we hold in our homicide detectives. We sit there, we hold everyone accountable. We ask, what can you bring to the table to help reduce violence? And then we have follow-ups. So the next time that we meet, I'm going to ask this question. You said you were going to do this. Did you do it? What was the result of it? Because we hold each other accountable, we find again, everyone's held accountable, and we see a reduction in violence based upon that. You brought up custom notification in my bio. What is custom notification? Custom notification is identifying those who have a high propensity to either pull the trigger or become the victim of a shooting. We take resources to their doors. The police department will find an organization that can actually bring resources not only to the person who will pull the trigger, but we're going to bring resources to their families. Those who are victims, we're going to bring resources to their victims. The goal is that we identify, and we know that sometimes violence isn't because that's what you want to do. It's a result of where maybe you live. It's a result of a lack of resources. So based upon all the data that we get, we identify those who have a high propensity for violence, and we bring resources to their doors.
You know, as you're speaking, Chief, the words remind me of a more familiar perhaps to our viewing audience, a more familiar model, which is the medical model. The idea of a social disease transference with people at higher risk. We saw this with HIV and AIDS. We saw this more recently with COVID. The idea of identifying people through data and through science who are more communicable and quarantining them, focusing on them. And I know that one of the people I admire is Dr. Andrew Papachristos, who's consulted with the Chicago Police on the social network theory, identifying people who are most at risk, as you suggest. If you're in a group, a gang, clique, a crew with someone who just shot somebody, your group affiliation puts you at higher risk. Even if you're associated with a victim of violence, as a family member or a friend or a crew member, you're more at risk. So connecting those dots, so to speak, with data, with not only ShotSpotter data, but social interaction analysis, social network analysis, can really drive the work you do. So thank you. I'll come back to you in a few minutes, but let me now turn to Assistant State Attorney Thompson.
Hey,
Welcome.
good afternoon, Ron.
Glad to have you join us. So you heard what the chief said about how it drives his patrol and police deployment and how he's incorporated with some of the other strategies. And I know Wayne's going to elaborate some more on that. But tell us, and by the way, 5 short years, you're already handling high felony cases. I think that speaks to your aptitude. I just want to say that's remarkable. But look, in the short time you've been in ASA, tell us about how you used not only ShotSpotter or any other technology, maybe like NIBIN. How have you used technology as you prepare your cases, as you help the police solve these cases? I know you work collaboratively. And then pre-trial strategy all the way to trial. Can you just kind of elaborate on your data acquisition and data integration into the work you do?
Absolutely. I mean, for us as prosecutors, again, being a trial attorney is all about storytelling, and ShotSpotter basically allows you to know the origin of where your story begins. I'll tell you, just like my last trial, I had a defendant. He fired about 11 shots at the victim. The backstory was basically he was upset that his girlfriend was stepping out on him with the victim. ShotSpotter allowed me to have a reference point with my detectives of, hey, I need you to go back. I need you to triple check. We are going to be scrutinized at trial for not finding these casings. But ShotSpotter also corroborated everything that the victim said, where he was shot, where the incident occurred. It gave automatically the police notification. But my victim actually drove to the police because they were notified so quickly. They were able to find the defendant or find the vehicle that was used in the shooting. And it helped us build up our case, although at points circumstantial. But there were certain elements or certain things that my detectives, despite having conversations and asking them to go back, ShotSpotter made up for oversights in portions of the investigation, because with it showing the exact area where all the shots were fired, the defendant was very clear about firing in a winding back street, not much cameras, not near really any other locations, that every time the defense attorney tried to cross-examine my detective, it fell short because we had a map, and we had a map that was introduced through our expert that works for your company of exactly where it occurred. So any shortcomings in the lead detective's investigation, who did a phenomenal job, but any shortcomings that there were immediately answered. And especially considering that our case was attempted premeditated murder, I think it rang true for the jury to hear the aggression and the violence from all 11 shots being fired. And ShotSpotter, you all record it, you all transcribe and put everything neatly together regarding the origin of a case. And that origin, even for persons who might not communicate their stories the best to officers or to ASAs who aren't used to being in court, who are shy, the evidence that comes from, or the information that comes from ShotSpotter, corroborates everything else, that the jury ends up having so many fewer or less questions. So in my experience, whether it's helping the officers respond more quickly or giving me a reference point to go back to have a very clear idea and have a very clear idea to answer a lot of the jury's questions, it's been amazing. It's been super helpful.
Thank you for that. And I can echo some of those comments. We hear from customers who say the first we knew of someone getting shot was when the victim arrived at the hospital with a private transport. They didn't want to get the police involved, so they didn't call the ambulance. A friend brought him to the hospital. And of course, the hospital protocol is they have to call the police on a penetrating trauma victim. And so the police get there, and quite frankly, not all bullet wound victims are honest about where they got shot and what led to them getting shot, because they may have been involved in criminal enterprise themselves. And so now the police are going to the wrong location, canvassing a neighborhood, coming up empty, thinking that's a phenomenon of stop snitching in the neighborhood, but they're in the wrong neighborhood because the victim has misled them. And it's also a time delay that they're getting to the hospital quite some time after the shots were fired. Witnesses have gone. They may never recover the physical evidence, as opposed to being directed precisely to where it happened in real time. Now you have the opportunity to get spent shell casings to put them in the National Integrated Ballistics Information Network, and also talk to precipient witnesses while they're still there, maybe even knocking on doors or ringing doorbells with people reluctant to call the police because of fear, now answering their door and maybe giving information. And lastly, integrating with technologies like cameras, ring doorbells, bank cameras, the ATM cameras, gas station cameras, all those other video assets, because you know exactly where and when the shooting occurred. You can capture those assets as well. And I'm sure you've used those.
And you even brought up a good point with shell casings. In my case, they actually weren't, despite going back to the scene 2 to 3 times, they weren't able to find shell casings. And because, again, with ShotSpotter, everyone could see exactly where those shots were fired and hear those shots ringing out. It wasn't a question in the jury's mind, even though it wasn't something, or ultimately it was an argument, a lack of evidence. It helps supplant and, again, make up for certain things that naturally in real time we just were not able to find or locate, because no one ever questioned that those shots were fired, even if the shell casings weren't located. So it's been extremely helpful in my position.
And a reminder that revolvers are still being used, and they obviously don't eject those casings. They maintain them in the gun. And we know that a lot of our shooters are getting savvy. They're picking up their brass. They sweep the brass, as we term it in policing. They'll take a few moments after they shoot, collect that evidence, because they've heard friends getting prosecuted based upon forensic evidence, and they pick up the casing, so there are none to be found at the crime scene, despite the best efforts of the police. So thank you, ASA Thompson, for sharing your perspective. We'll come back to you in a few minutes during the Q&A. Let me now turn to Mr. Rollins. So Mr. Rollins, you've heard from Chief Cato and ASA Thompson regarding their experience to police a community and to bring these cases to court for justice. You're working somewhat collaterally. You're working in the private sector, nonprofit sector, working in partnership with prosecutors and police, but you have a very different perspective. Share with us what you do, and please explain to us, if you would, this walking one step that I referred to, and also how you relate to group violence intervention. What is that, and how does that all work together with technology and data and stakeholder engagement? Mr. Rollins, I think I lost you. Wait for him to come back on.
Okay, can you hear me?
I can hear you fine. I can't see you, but I can hear you. If your camera comes back on, that'd be great. But in the meantime, I can hear you. So please, if you heard my questions, any way you want to begin, walking one stop, GVI, stakeholder engagement, and how you use technology.
Okay, sure. The Miami-Dade Anti-Violence Initiative is a community violence intervention strategy that utilizes the technology to direct our community violence intervention work. So, for example, with the Walking One Stop, we'll be able to dispatch social and economic service providers as well as health-related providers directly to the neighborhoods that have the most shots fired. So bringing a trauma-informed response to the residents in the neighborhood. Also, and whenever there is a ShotSpotter alert that results into a contact shooting, Ron?
I'm still here, but you were broken up. Try it again.
Okay. Yeah, I'm going to turn the video off because it seems like my bandwidth is quite not enough for me to be talking and video. So I'm going to shut that off because we keep going in now.
Okay.
So so at any rate, we utilize the ShotSpotter technology to alert and to initiate are out to a location that a incident has taken place. So the ShotSpotter alert will go to the police department. They'll dispatch their investigators and detectives, officers to the scene. Then they will send us an encrypted message on the Telegram app that a incident has taken place, and basic information about the incident that doesn't disrupt the integrity of their crime scene, but enough information for us to send our street outreach workers. It also activates our hospital-based violence intervention team. So we have a data coordinator that's in place at the hospital that is able to provide services to the victim that is brought into the hospital. And we have social workers that also support that data coordinator that works with the families upon their consent to provide service provision that includes relocation, mental health counseling, or many of the other small things that may be important to that family, like paying a light bill, or they need a phone because they need now to be able to communicate with us or service providers that are providing services to them. And so the ShotSpotter technology, of course, is used by law enforcement, but it's also a critical tool for us for community violence intervention. So let me talk about the Walking One Stop for a moment. In 2008, we hosted the South Florida Anti-Gang Summit. And at that summit, one of the objectives that was recommended is that we have one-stop social and economic service centers in all the areas where there is high incidence of gun and gang violence. And so back in 2008 was a housing bust, so we didn't have the ability to staff bricks and mortars and equip these one-stop centers. So by the grace of the Almighty, he said, why don't we take that one-stop center right to the doorstep of residents in the areas where those incidents have taken place. And we bring social and economic service providers, we bring mayors, we bring members of Congress, we bring state legislators, we bring criminal justice professionals, we bring faith-based leaders and clinicians. So we bring our social workers, and we bring all the services of the federal, state, and local government right to the doorstep of the residents where there's been the most incidents of shots fired or a serious gun-related incident. So we not only go there to the doorstep, but then we do a short assessment of what that individual service needs are. We make referrals to the appropriate agencies that can provide those services. We also have a staging area where some of those services are provisioned right on the spot. So if someone says, I need a job, they are then directed to our staging area so they can get on the workforce development bus and immediately get support with their workforce employment needs. And then if it is a referral that is made out to another agency, those agencies have a week to respond back to us on the services that they have provided. In addition to that, when there are ShotSpotter alerts in a neighborhood where we already have clients, that triggers a call from our social workers to our clients, a wellness check. How are you doing? Is everything okay? We heard that there was, shots fired in that area. Is everything okay? So we provide that. Something that we're integrating also is a school-based initiative that when we have those high incidents of shots fired, then we're working with the school counselors because guess what? Johnny lives where all those shots are taking place. Johnny went from an A student to an F student. He's not showing up at school anymore. So now we can intervene because we have the knowledge that shots are being fired at his neighbor. So that Johnny may be scared, he may be traumatized, he may be bullied, whatever the situation might be. But now we can intervene with the school as well. So the technology has been amazing for us as a community violence intervention tool. I know it works for law enforcement, but on the community side, it has been a tremendous tool that helps us to be able to provide services at the right place, quickly, efficiently, and be proactive in our follow-up with our clients.
Wow, amazing! And as so many communities across the country are trying to remodel their policing strategies. We hear many of them saying we need to do more to bolster the community side. You're so far ahead of it. You've already been doing that for a number of years in Miami-Dade. You've got the assets. Although we are working with limited resources, you're directing those limited resources more effectively and efficiently by being data-driven and intelligence-led. And I may forget at the end, but if anybody that's watching or listening to this wants to contact you to help maybe visit your community, see how it's being done so successfully in Miami-Dade, they should reach you. We're at wayne.rollins.com, or how should they get a hold of you to make that connection, come down and visit and see what you're doing?
Yeah, it's just Wayne at waynerollins.com, or just put in Wayne Rollins in the Google search. I usually come up first, on that search.
Excellent, excellent. And I know you welcome people to come down and visit and help to replicate the model that you have in Miami-Dade. Let me come back to you in a little bit during the Q&A. Let me now turn to Dr. Gerard Tate. As you heard in the introduction, Dr. Tate has had kind of 1 foot in law enforcement, 1 foot in social work, made that migration, has been working now with us at ShotSpotter to help with the community engagement piece, and particularly among his other specialties is the idea of trauma-informed care, recognizing that gun violence is not just affecting those where a bullet penetrates flesh, but all the people who suffer vicarious trauma, particularly young people. So Dr. Tate, would you just kind of pick up where Mr. Rollins left off and discuss how data can be used for good?
Yep, thanks, Ron. Can you hear me clearly?
Excellent.
Yep, absolutely. So one of the things that you mentioned when I first came on board at the company, I was introduced to Mr. Rollins and I saw the amazing work that he was doing. But one thing that I wanted to add to it was we're focused very heavily on those who are getting shot, right, in those households, as we should. But the mental health and medical research is clear that even the sounds of gunfire is traumatic and can lead to adverse childhood experiences that may put youth and young adults, particularly those in our high crime, high need areas, at a greater risk of carrying a firearm and using it. So even if no one is shot, what are we doing? And he talked about the wellness checks, the follow-ups, to bring in services and supports to those areas, to those specific individuals who are being traumatized, particularly the mental health and stabilization services. I think many police departments will find, including in my hometown of Chicago, that you may have a lot of mental health related calls in those same environments that you have in a lot of the gunfire and other quality of life crimes. And so how do we use our data about where gun violence is happening to send those public health resources and services, even things from food vouchers, I know Mr. Rollins brings out, employment opportunities, but crisis stabilization and connection to simple things like a dentist, right? And we haven't thought about this. You may have kids that may be using illicit drugs and popping pills, but when the last time they saw a dentist? What other things do they have going on? Do they have a primary care provider, right? In the neighborhood I grew up in Inglewood, most of those didn't, right? They dropped out of school. That's the last time they saw the doctor into the ER. So how do we use this data about where trauma is occurring, right? And I think that's just a little bit of, yes, it's gun violence, but the associated trauma is equally as important. And if you see a lot of this trauma, the research is very clear that puts people in that environment, not only just a higher risk of being hit by gunfire, but being traumatized psychologically and all the negative health outcomes associated with that.
So Dr. Tate, you've educated me a lot in this area. You mentioned just a minute ago, adverse childhood experiences, or the term ACEs, and recognizing that our brains as human species, we continue to evolve and grow to maturity, most of us into our early 20s, at least young men. And so you've given me the term disrupted neurodevelopment through adverse childhood experiences.
Yeah.
And can we just focus on that and explain it a little bit better for the audience? And also, how do we resolve that if it's happening? How do we integrate this data with the schools to make sure they're getting the services they need, not just the dental and the food and the jobs and the things that Mr. Rollins talked about, but particularly K through 12 or even pre-K, if those services are available in the community? How do we take ShotSpotter data or other data about crime and violent crime, identify these kids and give them the wraparound services they deserve? Can you elaborate on that a bit?
Yep. So I'll start with the first part of the question. So typically our brains continue to develop to our early 20s, 25, 24, depending on where you grow up. But that's in ideal conditions, right? You have enough food, you have enough water, you have enough love, you have clean air, you have access to resources, love, support. You start taking away those things, you start introducing lots of trauma, not healthy food, not drinking enough water, not enough exercise. Most of us can understand that your brain won't properly develop, particularly prefrontal cortex, when we start looking at children who may be hypervigilant, right? They may overreact to things, right? Which is something that we expect to see with this level of trauma that they're may be experiencing from gunfire. It's upwards of thousands of rounds going off around some schools and in some neighborhoods in our coverage area. Those young people that live in those environments are being affected, much like their parents. But the growing brain, right, is less capable of dealing with that level of trauma and growing and maturing the correct way. And so there are antisocial and conduct disorders that will develop that put them in a higher likelihood of being suspended, dropping out of school, having negative contacts with law enforcement, then meeting prosecutors, right? And so that's the first. The second, one of the things Mr. Rollins and I have been working on other customers is, okay, in those areas, there are school children that live there. There's a Handle with Care program that many of the police departments, police officers know. For many of the prosecutors who may not, if police respond to a domestic violence case or a shooting or others where it's implemented, if they see school-aged children, they take their information, pass it on to the school social workers and counselors so that the next day they can handle those children with care. But we need to extend that even more, again, because even the sounds of gunfire is traumatic. And if I may digress for 1 second there, if you can imagine your 3-year-old sitting on the floor while you're watching TV and 20 rounds go off outside your house, what is that 3-year-old going to do, right? Not only jump, run, scream, but their heart will be beating as a physiological response, as a cognitive response. Now imagine kids who live in these neighborhoods where since they're born, they may be hearing this each weekend and each summer over and over and over again. You can understand how it become a necessity and normal to normalize gun violence, putting them at a higher likelihood for using it. And on the back end, we're saying, why are they so comfortable with this level of trauma and violence upon other people? They've been experiencing them themselves for 18, 19 years. So how do we use that data to make sure the schools have it, make sure teams like Mr. Rollins has it, and like Chief Cato said, the GVI and violence interrupters to go specifically to those areas and those specific houses in those areas to intervene.
Excellent. Well, that's quite a bit to digest. There's so much there. So let's focus on I'm sure the people watching this are prosecutors. I've always had the mindset that they are perceived as the most legitimate law enforcement voice, elected officials in 45 of the 50 states. So what can they do from their position as prosecutors, elected district attorneys, state's attorneys, or the people who work for them to drive a lot of this because they have a great voice in the community? What more can they do to step out, to talk to school superintendents, for example? The police will do what they'll do, but how can they, as prosecutors, connect with these other community organizations to make sure this data is used, as you say, data for good?
Yeah, so the first thing I think is you interact with a lot of victims and witnesses and children already in your cases. And as you may call them in to speak with them and depositions and all of those things, some of them are going to let you know some needs that they have, which traditionally you're like, okay, that's not my role to do. But many of you may have victim services and victim advocates. So reaching out directly to them who you may see, this may be the next shooter or the next shooting victim, to have a process to either notify the schools, Mr. Rollins type agency, and others. Beyond that, there's a growing need, I think, from prosecutors and defense attorneys for diversion programs. There are not enough of them. So we're going to see the same people over and over again because they're not giving you a lot of choices in where those diversion programs exist. And so how do we grow those? Who do we need to partner with? Do we need to partner with the private sector for the elected ones that you may already be working with to get elected, right? And those local major business owners that can help and what those diversion opportunities look like. I think people won't expect it to be coming from you, so when it will, their ears may perk up, and I think they may pay more attention.
Great perspective, Dr. Tate. Thank you.
Let
me go back for a moment to Chief Cato, and I see that we had a question that was offered earlier. Do you think reduction in crime is more attributed to the community building or the ShotSpotter technology? And by the way, I would offer that they're not mutually exclusive. You can do both at the same time. Why would you have to make that choice? But then the question I want to ask or offer to you, Chief, is what do you say to critics who are concerned about over-policing in communities? And I know you have a strong background in use of force reduction, working in the Inspector General's office. I didn't even get to all that in your background. And so you understand constitutionally correct policing. You drive it, you lead it, you hold people accountable. Can you just address that concern that any technology, any surveillance technology or something like ShotSpotter is responsible for over-policing? How do you answer that? Because I'm sure you hear those criticisms in Chicago.
Well, again, it's about being able to collaborate and cooperate with other organizations. Too often, police respond to non-policing matters, which means you see the police more frequently. The goal is to get other agencies involved to respond to non-policing matters. When we have mentally ill folks, we should have folks with the capability to deal with those issues. So the goal now, even within the city of Chicago now, you know, we now have a program where we do collaborate and coordinate with other city agencies to respond to matters of the needs of the community. And I think that's one important thing, but also accountability. When we do find officers who have not acted appropriately, it should be dealt with swiftly. Another thing, we must have partnerships with the community. The community must understand what's going on within the community and how we're addressing it. So when you see the police have a partnership with other agencies, that's going to build trust. When you see the police, most importantly, have a partnership with the community, with the Block Club presidents, attending community meetings, understanding what the community needs. Sometimes the community may just need an officer just to stand in one spot, attend a party. But also when we say we're going to do something that's going to affect the community in a positive way, we must do it. So as long as we continue to collaborate and coordinate with other agencies and with the community and address those needs, I don't see a problem there.
Thank you, Chief. I appreciate that. And by the way, I've met you. I've been in Austin. I've watched you work. I don't know when you sleep, because the day job, the night meetings, and all the stuff you've done to engage your community in Chicago has been extraordinary. I wish that was the model across the country. If it were, I don't think we would have even received the question that we had from one of our attendees. Wayne, let me come back to you for a minute.
Yes, sir.
Okay, thanks. I want to go back a little bit more about how you, as a non-sworn, obviously a civilian, working with police, what does that look like? I need more detail about the information exchange. So I know prosecutors may be reluctant to share information. I know certainly police departments are. You know, they always say that information is a currency and has to be secretly held instead of shared and being transparent. You've driven a lot of transparency. How did you gain the trust of law enforcement, prosecutors to work with you so that you'd be more effective, to get the information you need so that you could properly drive all those community assets that you articulated earlier? How do you gain that trust? Is it just a matter of your personality, or is there a strategy that we can model for people that are watching this webinar?
Well, within the group violence intervention strategy, there is something called shooting reviews. And so in the Miami-Dade County, we had 3 shooting reviews. We have one that is strictly for sworn law enforcement, one that is facilitated by the National Network for Safe Communities at John Jay College, and the one that I facilitate. The one that I facilitate, we have the Miami-Dade Police Department, we have the State Attorney's Office, which is the District Attorney's Office in maybe the locality that, you know, some of you come from. We have the U.S. Attorney's Office. We have Parks and Recreation. We have the Housing Authority. We have our nuisance abatement liaison, all on the call. We have different divisions of the Miami-Dade Police Department. The robbery division will be on, homicide will be on, the general investigation unit will be on, and everybody has their boundaries and everybody respects the boundaries. So in addition to that, we have our social workers and our street outreach team. So in the community, the street outreach workers are not seen with the police lockstep, but during our shooting reviews, we all look at the incidents that happened in the previous week, and we analyze it from the perspective of street outreach, the hospital-based initiative, the social workers that are working with the clients on the ground, and of course from the law enforcement. And then if an incident is happening in and around parks, we have parks involved. If it's happening in and around a commercial establishment like a corner store, we'll have the nuisance abatement, and everybody weighs in on that particular incident. And invariably, we'll start talking about an incident. It seems like we're lost with just nothing but question marks. But by the time we finish talking about it and putting all the pieces of the puzzle together, we've figured out a lot. And it has helped with prosecutions as well as with arrests. And most importantly for us, on the side of community violence intervention, is being able to direct the social and economic and health-related services to the people that need it the most.
Excellent. We've got a few minutes left. I want to remind anybody that's watching or listening to either enter their question or comment in the chat or the Q&A, and you'll find those at the bottom of your screen. Chief Cato, back to you for a moment, just to pick up where Mr. Rollins left off on using street outreach. If you would, I've used that model. I know you know Tenny Gross and the Nonviolence Institute in Chicago, as it was based in Austin. I was a mentee of Tenny Gross when he was in Providence before going to Chicago. And the model we used was to have our street outreach workers working throughout the day, building trust, making connections. I was able to get them into the schools. That took a little bit of a lift to get the school department to allow them in the schools, K through 12, and then more effectively using them when there was a non-fatal or fatal shooting, deploying a team of 6 to go to the crime scene, to work, if you will, around the yellow tape, to go to the hospital, and then to go to where they expected retaliatory violence. And I know you mentioned that before. Is that still the model using in Chicago, or is there another model that's more effective? How do you interact? And I just want to focus particularly on information sharing, because when I worked with Tenny, it was unilateral. We would give them information. They couldn't give us any information, so not to be perceived as informants. So can you elaborate on your Chicago model and how that's being used today on street outreach?
Well, today, street outreach, they're notified when there's a shooting. They're notified right away. They respond at that particular time, and then they do what they do. Information, expecting any information from street outreach? No. Providing it with data so that they can go out there and ensure that they can get ahead of the retaliatory shootings? Yes. Now, I will say this. It took me a little bit to actually understand what they did and actually believe in the program. It wasn't something that I just said, let's do. We built up a trust. We built a relationship and an understanding. I took Tenny Gross and I actually put him in front of my officers, and I walked out of the room and I told my officers, ask him whatever you want to ask him, do not hold back. Well, Tenny Gross, he stood there and he took it. So what he was able to do was build credibility for himself. I wasn't there to ensure that he gained credibility. It was up to him to get credibility. And it was important that he did that so that when he had those outreach workers out on the street in their yellow shirts or whatever colors they chose to wear that particular year, the officers will understand why they were there. Because you have to remember the individuals that he chose to get in to actually get in the middle of violence are probably the same people who was responsible for violence in the past. So who's better to solve the problems than those who actually contributed to the problems in the past? So we find it effective. It's growing. It's a partnership that's important, and we hope to actually continue to grow that partnership.
Excellent. Obviously, your leadership is what was necessary in that mix, but I'm sure other police leaders forward-thinking like yourself would spend that capital, that leadership capital, to bring in a group of folks that may include ex-offenders. I mean, I can imagine some of the officers in your district then may have had encounters with some of the people on Tenny's team. Wayne, I'm sure that some of the folks you work with, having that criminal background that gives them the street credibility, gives them legitimacy. You know, police officers aren't real quick to embrace that. So again, it needs your leadership, Wayne. It needs your leadership, Chief, to drive that, because it's not a natural, harmonious relationship that's going to happen when you have people that have been on the wrong side of each other historically now coming together for a common mission. That mission is to make their community safer. So credit to both of you. I see we have 5 minutes left. I get another question in the Q&A. Have you gotten pushback from community groups regarding ShotSpotter? What specific concerns and how do you respond to them? And that's from Todd Barnes. Yes, and frankly, we have, although usually the community groups that are concerned are not the ones living in the neighborhoods where there's gun violence. Folks that may have got a false narrative from a news article, wanted to drive that, think it's an over surveillance tool, when indeed it's not. We only hear noises, discern those noises as gunfire, and then produce those alerts. The consequence of the outcome, if you will, that's what's driven by the police and the other social providers, social service providers that you've heard over the last hour. Those specific concerns is privacy, getting lumped in with other surveillance technologies like facial recognition, drones, UAVs, license plate readers. If there's going to be a pushback, it's a pushback generally about surveillance tools, but not specifically about ShotSpotter necessarily. That would be my first response, and happy to address any specific concerns that anybody watching or listening has. And I'll just pop up our contact or my contact information here. I can share my screen.
Ron, if I may also add something really quickly
while
you're doing it. I also think part of my role as the Director of Community Impact and Engagement and addressing that is speaking to them specifically about how we're using our data for good, our best practices and how we train our customers, but how we partner with people like Mr. Rollins and others in other cities to ensure that that data is being used to drive for far too long much needed social, economic, and health resources that that is quite obvious should have been there already, but we're using our data to drive it now.
Excellent point. And that's something that ShotSpotter did about a year and a half ago, was to bring in your expertise, Dr. Tate, and your colleague, Paul John, from Everytown Mayors Against Illegal Guns, people that understand community engagement, generating those conversations, being open and transparent, explaining not only the technology, but the best practices and the way that our customers, that mostly police departments and the social services they work with, can provide those services, whether it be rapid response to a shooting in real time to save a life, gather evidence, and help bring that to justice, but also engage the community at the time of the shooting, and then following up with the services that Mr. Rollins articulated. Well, thank you everyone for your participation on the panel, and thank you everyone for attending. If you have any other questions that weren't addressed that may come to mind later, or if you want to have a further conversation about bringing ShotSpotter to your community, please reach out to me. My contact information is rteachman@shotspotter.com. And if you want more information about the services we provide, not only gunshot detection, but also case management, data integration, and patrol management, we have a portfolio of solutions now that called Precision Policing 2.0. We'd be happy to explain those to you as well. So again, rteachman@ShotSpotter, and go to the website, shotspotter.com. And with that, I'll stop sharing and turn it back to you, Ms. Green, for closing comments.
Thank you so much, gentlemen. I'm so appreciative to have you this afternoon for such a lovely program. One thing I'm going to say first and foremost is that I wish that this was being presented at our conference that's coming up next week. Actually, we're just going to start registration on Saturday for people to arrive, because I think that the information that you provided is invaluable, and it cuts across the country. I'm in New York, and everything that these gentlemen were saying rings true. I use ShotSpotter technology for all of my shootings that I've been on in the last 6 years. There's been some touch point with ShotSpotter, and it's absolutely amazing. So I want to personally thank Ron, Mr. Rollins, Mr. Tate, Chief Cato, and Mr. Thompson for your time. One of the things that we have coming up also is, like I said, the conference, and ShotSpotter is a partner with the National Black Prosecutors Association for our conference. They will be present on scene and available to speak with you during the entire week. And so I encourage you to touch base with ShotSpotter representatives. They will be attending the luncheons, and they will actually be presenting a display exhibit on Wednesday and Thursday during next week. So with that, I thank you, gentlemen. Again, I can't thank you enough. Thank you is not enough. And I hope that you have a blessed rest of your day, a wonderful weekend, and feel free to reach out to Mr. Teachman and everybody else on the panel. Gentlemen, if it's okay, I can provide your information. I don't want to bombard you, but if it's okay. Ron, I think you're going to jump in.
Well, I was going to say, I don't want to put that on you, but absolutely, if you're willing, anybody that wants to reach out to any of the panelists, you have all our information, not just mine. Please receive that request and forward it to the appropriate panelists so they can follow up with any of your attendees. Thank you.
And my only disclaimer to that is that these are all working people. So please give them time to respond. We are all very, very busy. Crime is always open for business. And so we are always open in business. And so please give them time to respond to your emails and your inquiries.
Thank you.
With that, I have nothing else.
Thank you.
Thank you, gentlemen. Have a good one.
You too. Bye-bye.